I'm delighted to be here speaking about NICPAD and just sharing some of the work that we are doing in this space. So today, just wanted to share about the ongoing work that we are doing in the NICPAD Connect. NICPAD is National Center on Health, Physical Activity and Disability. Most of you know about the center. The center has been funded for several years, over 20 years. And in the last cycle of funding, there was a special emphasis on having a very data-driven approach to NICPAD activities and increasing the reach and effectiveness of health promotion programs. So we'll go through some of the work that we are going and why this work is very important. So before that, I wanted to acknowledge the team that has been really working behind this. Some of them are in the audience over here. Would not have been possible without having an amazing team and investigators like Zoe and Larry, and who is not over here. He'll be presenting tomorrow on a separate session, but really excited about the team that we have that supports, and the community partners that really help us improve our programs improve what we do within NICPAD to really increase the effectiveness of this programming that we are doing. So the keynote speaker Linda really emphasized the disparities between that exist nationally and at state level, and this map over here really emphasizes how within the Deep South we have a high prevalence of chronic disease, but also a very high prevalence of disability rates. And if you overlay that, when you think about the incidence or prevalence of diabetes, hypertension, cardiovascular diseases, or even deaths, and overlay with disability rates, it's pretty significant in the region we are in. And that has a connection in terms of we see that the disability related chronic conditions are an issue, and also the chronic conditions leading to disabilities as well. Now, if you layer that with some healthcare shortages nationally we have, the lack of inclusivity at the healthcare level, that really emphasizes the need for us to have programs within NICPAD, a public health approach to really help our communities, help people with disabilities improve their health and wellness. So when you think about chronic diseases, disability, then you layer the intersectionality of rurality, racial disparities, and also the barriers that are at the health system level, including just the shortage of primary care workforce that could support everybody, but also people with disabilities in managing and preventing their chronic conditions. This becomes a pretty big, significant issue, and something that we all need to be working towards. So in that sense, NICPAD Connect is the platform, is the mechanism for us to really connect individual with inclusive health resources. It's developed in a way that we are trying to partner with healthcare systems, we are trying to partner with community health organizations, and really build three strategies. One is around health screening and wellness. The other strategy is around improving access and developing new health promotion programs. And the third is capacity building, which is around really increasing the awareness and making the healthcare systems more inclusive, so that we also can work with them more closely and have referrals through NICPAD Connect. So NICPAD Connect is a platform, is a mechanism for members to join, and then that helps us not just collect data, but really connect them to health promotion programs, learn from them, and continuously improve. So I briefly mentioned about the strategic priorities of NICPAD Connect. It's about building a healthcare to wellness infrastructure, and that's a very critical component, making sure their screening rates The diabetes prevention happening at the primary care level is going the way it should be going. Promoting health and developing and promoting new health promotion programs. From NICPAD point of view, we are doing a lot of telehealth programs that are being promoted through NICPAD, and so really establishing and diffusing evidence-based programs. The third is capacity building that I mentioned again about disseminating inclusive health promotion resources. In some sense, it's also training workforce, healthcare workforce to really understand the current barriers and address those, and developing strategic partnerships. For me, this is an opportunity for also us to think about a learning health system approach. So a lot of work that I do in the primary care area is from a learning health system approach, where we are collecting data. We are collecting data as part of regular patient encounter work, and then trying to see how can we improve the reach, the access, the effectiveness of the programs that are being delivered. And when you think about a learning health system approach, I also think about supporting quintuple aim, which is improving patient experience, improving population health, reducing cost, improving provider experience. There is a workforce shortage, and also trying to train them about how do you really make healthcare inclusive for people with disabilities, and health equity for all. So to me, what we do within NICPAD is an extension of this idea of a learning health system, but really now trying to bring our learning public health and healthcare learning system together, integrating these together, because we want to improve what we are doing at NICPAD, and we also want to address the barriers that are existing at the healthcare setting level as well. So the typical journey of a member within NICPAD is, they are referred by our partners, and there is a screening and sign-up process which is digital. There is a call center that also helps members to join NICPAD Connect, and there is an assessment done, which further is to really understand how well they are doing in terms of their health and wellness. And based on that, we are also able to then refer them to the 8-week mentor program, which Dr. Rimmer has developed over the years. And it has a couple of components around mindfulness, exercise, nutrition, and resilience as well. And then there are specialty programs. These are the Strategy 2 programs that are being developed. So we have growth that Dr. Lanzi has developed. There is State of Slim, everybody that has been developed with help from Dr. Hill and Dr. Hollywide. And then Dr. Young, Zoe Young, has developed M2M program, which we have studied, have understood through several of our trials, and will be diffused within, implemented within the health promotion program. So it's a journey. Layered on that is the data coordinating center and the evaluation performance measurement team, with the intent of really improving each aspect of NICPAD Connects, both Strategy 1, Strategy 2. How well are the health promotion programs doing? Are there certain aspects of data collection or the aspects of the components of the program itself that need to be improved? With Strategy 1, how can we further increase the referral and make this center really national? And I can share some data around where we think there are opportunities for us to grow. So in terms of just the nuts and bolts of the data coordinating center, we have an electronic data capturing system. We try to make the process as less burdensome, both for members and our site referral partners, by automating the workflows. From an evaluation point of view, and tomorrow my colleague Larry will speak more on that, we use the implementation science RE-AIM framework, reach, effectiveness, adoption, implementation, and maintenance, but also use a very standard quality improvement framework of plan, do, study, act cycle. We are also having national data sets and having capabilities to include text messaging and IVR. these are a couple of surveys that we have incorporated based on what we have seen in national data sets, and the idea is that we can compare these with the national data sets. We have developed a very large set of statistics and descriptives that is now displayed through a nice dashboard that my team member Salma has developed, and really improving that continuously to move forward. Again, the numbers may not be as clearly visible, but we track each and every part of our step about who is interested, who is then migrating to a health promotion program. And in terms of the demographics, we have some opportunities most of our members are from urban areas, so we have some opportunities to grow our reach in the non-urban settings as well. And that's an area that we try to see if there are community partners that we could work with and improve our strategy one reach. Again, tracking monthly enrollment in NICPAD Connect is a big thing, trying to see whether we are improving year on year in terms of our enrollment. So if you see from year 2 to year 3, for the same month, we are seeing improvements consistently, which is a good sign because we are continuously optimizing our approach to data collection and how we do outreach. Again, an example of the geographic reach of where things are. Obviously, we right now have a lot of interest regionally in Deep South, but we are also trying to grow across all the different states and really have a national representation. Some examples of comparing our data with national data sets. So we are comparing how do our members do when we compare it with what is happening nationally, and that helps us think about, again, are there specific members who may benefit from programs, or again, from a reach point of view, thinking, do we need to broaden our reach and address, make sure that we are able to be inclusive for all the people with disabilities, so these are national data sets are extremely helpful in those lines. Trying to think about some of the NICPAD Connect survey completion rates. We have done this for both mentor program and NICPAD about trying to see how do we minimize the burden on our participants, on our members in completing this, and where is the dip happening, where is the loss of interest in the surveys. So this is just a brief highlight of our 2 other health promotion programs, so Mentor, and there's another one, Growth, where we have again a significant number of membership in Mentor because it has been enrolling participants. We have enrolled participants, members for a while over there. Growth is relatively new, and I know some of my colleagues are also evaluating that as part of as a part of their dissertation. But that is really again, we are looking at these numbers from a point of view like how do we increase the reach of these programs, but also the effectiveness. And I'll give you an example. So when we look at Mentor, which we have evaluated pretty regularly, we are trying to look at, how are the risk, are the resilience scores, are the mindfulness scores, physical activity scores improving, pre and post. And I think that's really what is our ongoing work. Some of the other things that we are doing are around, my team member Vasil is working on implementing an AI-based note classification system, the idea being, again, bridging what we are doing, bringing what we are doing at the healthcare level, also in the NICPAD Connect data coordinating center, so that essentially when we have a call center, we could have a system where these calls get recorded, where we have coaching calls, we can have coaching call notes created, and also themes identified from an evaluation point of view, using AI to also do some quick evaluation for qualitative interviews. And one area where we haven't done much, but there is a growth opportunity for us from a NICPAD Connect point of view, is also how do we use claims data Inda mentioned about the Medicaid data set, so we have some access to that, and it may be helpful to even look at those data sets to do some longer follow-ups of our members and do data linkages. So thank you. My time is up, and I appreciate your all going through this material quickly.